It is a beautiful time in Benin City, and thanks for still being there. Of course, the program is This Morning on ITV. We're going to be looking at today, one thing that a lot of persons don't even care about, your blood pressure. Now, you hear people say high blood pressure, low blood pressure, and of course, hypertension and all that. Now, what are the relationship between high blood pressure, hypertension, low blood pressure, and hypertension? Are they related in any way? In other words, have you checked your blood pressure this morning? For some people, it's a daily routine, and of course, for some, it's periodic. So whichever way you may want to do it, you must keep your blood pressure intact. Well, good enough, today is World Hypertension Day, as recognized by the United Nations. And of course, we also understand that the World Health Organization and agents of the United Nations also recognized today as World Hypertension Day. Well, I've got seasoned experts when it comes to hypertension now, and of course when it comes to cardiovascular issues, heart issues, and all that. We've got some seasoned experts in their right from the University of Benin Teaching Hospital. First and foremost, you're welcome, lady and gentlemen. You're welcome to the program.
Thank you very much.
All right, now, so we have Dr. Isosa Ogbomo. She's a consultant cardiologist with the University of Benin Teaching Hospital. You're welcome to the program.
Thank you very much.
You're welcome.
Good morning.
And also, too, we've got Dr. Akinwumi Ojo, a senior registrar in cardiology with the University of Benin. You're welcome.
Thank you.
You're welcome. And also, Dr. Osaigi Egbodion is also a senior registrar of in cardiology, also with the University of Benin Teaching Hospital. You're welcome one more time.
Thank you very much.
All right, so let's start from the very basis now. When we say blood pressure, what do we mean? I'll start with Dr. Isosa.
Thank you very much for having us on this program today. First of all, I want to appreciate the Nigerian Medical Association, who have collaborated with the cardiology unit of the Department of Medicine in University of Benin Teaching Hospital for us to be here. I also appreciate the management of ITV for having us. Today has been marked as World Hypertension Day all over the world, because we know that hypertension is one of the leading causes of deaths, of preventable deaths all over the world. That is why the World Hypertension Federation decided to pick a day, which is the 17th day of May every year, for us to raise or increase awareness of this thing we call blood pressure. Most times we go to the hospital, we check our blood pressure, they say, oh, this person is hypertensive. So we say somebody is hypertensive when his blood pressure is greater than or equal to 140 over 90 millimeters of mercury on 2 or more occasions. Then we say that somebody has hypertension. When do we say somebody has hypotension? When the blood pressure is less than 90 over 60 millimeters of mercury, then we say that the person has hypotension.
So in other words, hyper means high,
yes,
hypo means low.
Yes,
All right.
Yes.
Okay. Now, we understand that when we say blood pressure, high blood pressure, of course, now, it tends to be an issue that is related with age. I don't know, you hear people over 40, that's when they begin to think of their blood pressure and all that. So
yes.
Is it in any way related to age?
Yes. Hypertension, the risk for hypertension actually increases with age, with people who are age 65 years and above being most commonly affected. Although hypertension can occur at all age groups, but it's more common, the risk of hypertension increases with the patient's age. Okay.
Now, Dr. Akinwumi, is this somehow that is more localized here in the black world? Because we've discovered that for some time now, it's been an issue. You hear people say that that man just died. He fell and he died. He slept, he didn't wake up. And if you trace the root cause of the death, is somehow related to blood pressure in this part of the world. So is this something that is localized here?
Thank you very much. Frankly speaking, initially, what we have in this part of the world is what we call the communicable disease, malaria and co. But due to our change of lifestyle and everything, we now have the non-communicable disease like hypertension, very prevalent among us, especially due to change of lifestyle. Our diet has changed, our lifestyle has changed, a lot of things that have changed about us. So we now have high prevalence of hypertension, even among us due to change of lifestyle.
Okay. All right. Now, Dr. Osage, you know, we're just trying to create the awareness here. Now, hypertension now, high blood pressure, hypertension. If we have hypotension, that's low blood pressure now, does it have any effect? What are the symptoms? In other words, what are the symptoms of hypertension, high blood pressure, and hypotension, low blood pressure?
All right, thank you very much. Most times, the symptoms of hypertension is not obvious. It's usually asymptomatic. What that means, it means that somebody can have elevated blood pressure, which is hypertension, and be moving around, doing his normal daily chores and activities. Little wonder you hear of somebody, oh, he was perfectly well, okay, jumping around, all of a sudden collapsed and died. So most often the time, in more than 90% of the cases, usually asymptomatic. There is usually no symptom. However, you can have symptoms like bizarre symptoms like restlessness, headache, confusion. That is usually when the blood pressure is remarkably very high. That is why we always talk about early detection of the blood pressure. Go to hospital, check your blood pressure, because if you were to follow the symptoms, you will hardly not see. But like we know that there are two types, the essential hypertension, which is the primary hypertension, and the secondary, which is, of course, less common, with somebody who has kidney disease, somebody who has other vascular problem. They could have symptoms, leg swelling, abdominal swelling, facial swelling. Those are the ones that have secondary hypertension, which is less common than the primary. Of course, the primary usually asymptomatic. So I will advise that those who, it's a routine. You take it as a culture that you go to the hospital once in a while to check your blood pressure. Because if you wait for symptom, it might not even come. Okay. And little wonder you see somebody just collapse, no symptom, and died. Okay.
Now, Dr. Esosa, you hear people say at times, because whether we like it or not, before we do go to the hospital, I think we must also teach ourselves how to know that this thing may just be high blood pressure. We hear people talk of some funny headache signs, symptoms and all that. At times they begin to have blurred vision. At times, you know, tiredness and all that. Now, outside that, is there any other way before we go to the hospital for us to know that this is high blood pressure?
All right, thank you very much. Now, hypertension most times is referred to as a silent killer. So we don't need to wait for complications to arise before we run to check our blood pressure. So while we are here today, we are here to advocate, to advise that wherever you are, get to the nearest place you can check your blood pressure today. You don't need to wait for complications. Yes, hypertension can present for the first time with complication of stroke, sudden onset of facial weakness, arm weakness, leg weakness, or sudden collapse. That may be the first presentation if he's having a stroke already. It may present for the first time in heart failure. He has difficulty in breathing, he gets tired easily, has leg swelling, or it may present with features of a heart attack, what we call myocardial infarction, with sudden onset, may have some chest pain that is worse with activity. These are some of the complications. Dr. Osage had earlier mentioned kidney problems. Those who have kidney disease will present with facial puffiness, leg swelling, abdominal swelling, and they will urinate frequently at night. And sometimes they pass frothy urine. Okay, they pass frothy urine, urinate excessively at night.
What do you mean by frothy urine now?
Frothy urine, it's like soapy urine, as an easy way to put it, like soapy urine. When they pass urine, it looks like it's soapy. All right, so these are some of the features of kidney disease. Yes, hypertension can also cause what we call hypertensive retinopathy. So it can present for the first time with eye problems. So that's why we are here today to remind us that we should check our blood pressure. Now, the theme for this year's World Hypertension Day says, measure your blood pressure accurately, control it, and live longer. So we are here to tell us, to advise us, to check our blood pressure today and do so from time to time. We don't need to wait to have symptoms before we start running here and there. Hypertension is a silent killer. It may not give any warning sign, or it may come with complications, and by that time, there will be little or nothing we can do to help you. Okay. So it's better we check on time.
All right, now, so Dr. Akinwume, before we talk about the thing now, for us to measure our blood pressure accurately, because that's an issue on its own. Yes. Now, Dr. Akinwume, what are the lifestyles that we must identify so as to know that if we continue with this, we're going to be having high blood pressure and all that, which will lead to hypertension. What are the things that we mustn't eat? What are the drinks that we mustn't drink? Is it just good to just continue with a certain lifestyle, Dr. Akinwumi?
Well, thank you very much. We cannot overemphasize the importance of lifestyle changes in the management of hypertension. In fact, some level of blood pressure around 140, lifestyle change alone itself can help to actually reduce the blood pressure. Even for people that are on medications, we also advise that to add lifestyle changes to this medication so that they work hand in hand to make sure that the blood pressure is controlled. What are this lifestyle? The first thing is sedentary lifestyle. A lot of time our job, sometimes make go to sit in one place from morning till night, you drove yourself to work, sit down from 8 a.m. to 4 p.m., enter car again to the house, and routine like that. That's sedentary. Then our food also, junk food that are very high in the cholesterol and coke, are risky lifestyle that we should check in order to stay healthy. Also, our salt consumption is also very important. Some people habit of putting extra salt on their food, it's not so good. And also alcohol, some people drink a lot, and all these have effects on blood pressure because they directly affect the blood vessels. And when we're talking about hypertension, we're talking about the problem with the blood vessels. And also smoking must be checked. Exercise regularly, it go a long way to make sure that our blood pressure is controlled.
Okay. Now, Dr. Osagie, we talked about the theme, the need for us to measure our blood pressure accurately or correctly. Now, we have so many gadgets around now, some electric gadgets and all that, you know. We also have the traditional, can I say the traditional way now, or some of the most oldest orthodox gadgets. You used to go to some health facilities, they still measure you in a very old way, so to say. Now, you discover that the gadgets we have around is an issue on its own. Most gadgets don't give you the accurate measurement. So what do we do?
Oh, thank you very much. Like you said, accurate measurement of blood pressure is very vital to the management of hypertension. All over, you could see that there are a lot of gadgets for blood pressure monitoring. I will advise that if you want to check your blood pressure, one, you see a cardiologist, if possible, but if not, you can see a general practitioner who can check your blood pressure. We have the sphygmomanometer, which we usually use in our facility, because that's based on your knowledge and experience. You could say what the blood pressure is. But the one that is common, that we see all over, is the automated sphig, which, of course, most people use. That is not an issue to me, but I think if you have that, you need a cardiologist to also go through and to be sure that it's well calibrated. Because when it's not well calibrated...
What do you mean by well calibrated now?
That's for example, you bought the automated sphygmomanometer, you want to check your blood pressure with it, you have to let a doctor go through it, be sure that's accurate. Most often the time you compare with the one you have, the one we usually use in the hospital facility, with that, so that you are sure that whenever you check your blood pressure, that is what the value is accurate. Not just buying it, taking it home and check your blood pressure and everything. And above that, I think recording is also a factor, because there are many things that can affect somebody's blood pressure. Oh, imagine the stress of the day, adrenaline release, you check your blood pressure is elevated. That might give a false blood pressure. So serial...
You mean at times naturally
yes.
Our BP can just go up?
When there's a sympathetic drive as a result of the stressful day or your other tension, under emotional stress or whatever, because of the sympathetic drive, the blood pressure can transiently be elevated. So above checking it, one of the ways you can check accurately is a serial check. You will do a serial and document it, so that when you see your cardiologist, you will look at the profile. Oh, at so time, because the blood pressure during the day and the blood pressure during the night, obviously it's going to be different. So these are things we also check.
You know, when you talk about this blood pressure, now, I begin to look at it as a kind of an elastic, something that we mustn't allow it to stretch beyond a certain level. You know, that's the way I begin to say it now. All right, so Dr. Isos, some of the medications we have around, they have effects, you know, adverse effect that you are treating high blood pressure, you begin to, you know, suffer some other things and all that. So in that situation, what should we do?
All right, thank you very much for that question. Now, we have guidelines, laid down guidelines, Nigerian Hypertension Society. We have several guidelines that we use. So when someone is newly diagnosed of hypertension, we will individualize the patient and know the ideal medication to give to a patient. While we are giving that prescription, we are aware of the likely side effects of that medication. And most times we will let the patient know that if he develops any such complications, he should let us know. I will know how to adjust the medications accordingly. Then we also know the patient's history. For example, you have patient A, B, C, and D. You may not necessarily initiate antihypertensives with the same medication for the 4 patients. You need to take the patient's condition into cognizance. For example, a straightforwardly diagnosed black hypertensive, for example, there's a group of medications we give. But if you have a black hypertensive who is also diabetic, there's another group of medications we give. So there are some things we see in a patient. Oh, a patient is already having leg swelling. We know some antihypertensives can cause leg swelling. We will not go ahead and give that patient an antihypertensive that will cause leg swelling. Instead, we will give a diuretic that will also help in reducing the leg swelling that patient is having, for example. Yes, most medications have side effects. Not all patients will react to those medications. I will look out for them. And it's not common.
Okay. All right, so Dr. Akinwumi, I want you to talk about the heredity factors now, because we understand that a lot of persons have become hypertensive because they have that trait, you know, in their family, you know, line. So you talk about that.
Yes, heredity is another major risk factor that has been documented as risk factor for hypertension. It then means that if someone has a father or mother or siblings that are hypertensive, such individuals have a high tendency of developing hypertension, and in short instances, one should actually go for a check. And as I have rightly said earlier, that most of the time there is no symptom, person will not know. So until you check, they are able to discover. So we want to emphasize that as many people that have relatives, family, parents that are hypertensive, uncle that are hypertensive, should actually take their blood pressure, whatever they age, because you've seen people 18, 20, you know, even lesser than that, developing hypertension. So it's before that, so over 40, but now we've seen very young people who are coming down with hypertension because of this factor from genetics and hereditary factors.
All right, Dr. Osaige, the medication, is it for a lifetime or for the period you become hypertensive? Because that is an issue. A lot of persons had hypertension, and of course some drugs were prescribed. They took those drugs for a period of time. Maybe they went to church and their pastor told them, oh, you are healed and all that, and they stopped taking those medications. So is it for a lifetime treatment or for just the period that you are diagnosed of hypertension?
All right. Thank you very much. This is a very popular question that most patients do ask in our clinics. The truth is that it depends on, first, what's the cause of the hypertension. Like we said, that hypertension could be essential. That one due to genetic, hereditary, while another one could be due to the secondary cause, which a patient who has chronic kidney disease, for example, and not develop hypertension. So there are two different classes. And also, it also depends on what the blood pressure is. If I check a patient for the first time and the blood pressure is 140/90, I repeated it and it's 140/90, and somebody who has 200/120, there are two different.
So 140/90 seems to be the normal range.
No, 140/90 is anything above or equal 140/90 is hypertension already. So the first thing is lifestyle modification. Some person can just have hypertension for the first time, you make a diagnosis of it, and just lifestyle modification can control the hypertension. You don't necessarily need to start your antihypertensive. Lifestyle modification can also help. But if lifestyle modification is not now helping us, having done it adequately, then you now initiate your antihypertensive. How long will you place this patient on antihypertensive? It depends on the control. How has the control been over the period of time? Oh, you discover the blood pressure has been coming down. Remember, while you're taking your antihypertensive, you're also doing the lifestyle modification. Avoid too much alcohol, don't smoke, avoid sedentary lifestyle, exercise based on the protocol as given. If that is done, then you can now taper it. Oh, maybe for example, I started the patient with amlodipine 10 milligram. You can decide to come down 5 and see if there is control. Of course, there are some who we have to take it for life. Oh, somebody who already has a genetic problem. Oh, somebody who already has a cause of their hypertension. Somebody who has a chronic kidney disease, for example. He has not done a transplant and the kidney is already diseased and is developed. What do you do about it? So if you are treating, the blood pressure is controlled, immediately it stops the drug, the hypertension comes up again. You understand? So it depends on what is causing the hypertension. It depends on the blood pressure range. If the blood pressure range can be controlled by lifetime medication, you don't necessarily need to start giving your antihypertensive. Or even if you start, you can taper it down and see the control. If the control is good, why not? But if the blood pressure is not controlled because there's something that is making it consistently being elevated, then sorry to say that person has to be antihypertensive for a very long time.
All right. Now, Dr. Isos, let's talk about, we've talked about some other issues that are related now, you know, because the person has diabetes, of course, that person will become hypertensive and all that. Now, let's look at, for some people, they don't have hypertension, but their blood pressure is just on the borderline. It's not necessarily high, it's not necessarily low, it's just on the borderline. What are the things that those kind of people should do? You know, that because those kind of people at times, they live in fear that, oh, my BP is on the borderline. What should I be doing to ensure that he doesn't get close, you know, to that? So what should they do?
Thank you very much. By reason of having concern for this group of people, a new group of people were termed or tagged as pre-hypertension. Those who are having blood pressure 130 and above and less than 140
on the borderline.
Years. So what we do for those ones, we do lifestyle modification. Number 1, low salt diet. Number 2, increase exercises. Number 3, stop cigarette smoking, cut down on alcohol, take more fruits and vegetables, exercise regularly. We usually prescribe exercises for at least 30 minutes a day, not less than 3 times in a week. So with these measures, we'll be able to delay and then maintain good body weight. Body weight is usually another issue, obesity or overweight. So usually when we do all this lifestyle modification, the blood pressure would likely remain within normal range.
Okay. All right. So, Dr. Akinwumi, you also want to talk on that too?
Yes. Lifestyle modification is very important, and for this group of people that we have mentioned, pre-hypertension, and we don't want them to go higher, to cross the line to hypertension. And it's very important that ordinary using salt in diet can reduce blood pressure to as much as 8 mercury. And if you are maybe you are 130, 138, for example, and you practice this, and that reduces from 138 to 130, that's a lot. So you go a long way to actually control the blood pressure. So not to talk about other measures like alcohol reduction, stopping smoking, exercise regularly, taking fruit and vegetables. So they actually, we call it the accurate approach to stop hypertension, and it's been found that it works, it has its place in the management of hypertension. And for this group of people, it's very important for them to do that so that they can gradually their blood pressure without necessarily taking medication.
Okay. All right. So the program is still this morning on ITV. We're reaching you directly from Benin City, and we're talking about today, which is the World Hypertension Day. Of course, you know that when we talk about hypertension, there's no way we cannot talk about high blood pressure, which is a very big issue with a lot of people, and also low blood pressure too. All right, so when we return, we're going to take a short pause now because we understand that somewhere in some advanced countries, here you hear people say that don't take salt and all that. But medicine seems to be improving and developing by the day. We understand that in advanced medicine now, even if you take salt, there are types of salt that you must take if you're hypertensive. So we're going to be asking the specialist here when we return on the other side how true that is. Please stay tuned.
TMI, every opinion counts.
Okay. All right, thank you so much. The program, The Independent Television, this morning on ITV on Independent Television. Of course, we've got 3 specialists here three cardiologists, you may want to say, when we talk about hypertension. They've been able to talk about what hypertension is all about, and of course, what is high blood pressure. And they've also mentioned that there are lifestyles that we must ensure that we keep with, such as the kind of food that you eat and the kind of things that you put into your food. Now, you hear people say that the intake of salt, the volume of salt that you take is very, very essential when we're talking about high blood pressure. But we also understand that in some advanced medicine now, there are types of salt now that is being, kind of being developed for high blood pressure patients. All right, so Dr. Isusa, I'll start with you now. We are still in the developing world. Here, you hear people say, mind the way you take salt and all that. But in advanced medicine, perhaps in advanced countries, they've been able to develop some kind of salts for hypertensive, patient. I want to speak on this.
All right. Thank you very much for that question. Well, here, as at today and here and now, I'm not aware if any of all those developed salts are available. For the normal salt that we have here, what is prescribed is that the sodium chloride that we take should be less than 6 grams, or sodium per se less than 2 grams. But the next question is, once I go to the market and I want to buy, how do I tell them to measure 6 grams of sodium chloride or 2 grams of sodium? So what we usually just say is that you should not add extra salt to your food. That's what we advise for now.
In other words, when this food becomes too salty.
Yes, we don't want extra salt. You know, in those days when you go to the eatery to buy food, you have an extra bottle of salt there and then you add it like this. No. That's what we say we don't want. There are some foods you will take too. When you taste it, you know that, oh, this food is salty. You should know that you should avoid such food. But those other developed salt you are talking about, we don't have them yet. So all we can just say is that whatever salt you get in the market and you are cooking, we are not saying don't cook with salt at all. No, you can cook with your salt, but reduce the quantity. And it's better to put the salt in for example, you are boiling a pot of rice. It's better you put the salt when there is still water in that pot of rice. But if, for example, you have finished boiling the rice and you taste it and, oh, the salt is not enough, no, eat the rice like that. Don't add extra salt on the table.
In other words, you hear people say that it is safer to put your salt on the food when it's on the fire,
yes,
not after you have chopped.
Yes.
Now that seems to be a big habit, Dr. Akinwumi.
Yes. You see some, you take some dining tables, you see some people, there are a salt container there on the table. And the father of the house will come and say, oh, my wife, this salt is not enough. Let's sprinkle some additional one. So those are the habits I would say it's wrong, because the more the salt, the more the blood pressure.
Okay. Now, Dr. Saige, how is this day going to be observed now at UBTH? Because it's a big day, there's no doubt about it. The awareness must be there. I know that some arrangements have been put together to create the awareness. So how are you going to observe it today?
Thank you very much for that question. As you can see, we are well dressed in our outfits, prepared for the day. Today is being marked for World Hypertension Day, creating an awareness on early detection, because if you detect the blood pressure early, that's hypertension, elevated blood pressure, it can be controlled. Like the team says, that measure your blood pressure accurately. Control it, live longer. So this is the team, and that is what we are focusing today. As specialists in the University of Benin Teaching Hospital, we are organizing a program today at the Center for Disease Control in UBTH, the front of UBTH there, where we will be doing check, that is blood pressure check for all patients or clients that will be coming today. And we are also going to be doing other investigations like the cholesterol, because one of the risk factors for developing hypertension is high cholesterol level. So we are going to check the lipid profile of our patient. We are also going to check measure the body mass index, because we said before that one of the risk factors for hypertension is obesity. How do you measure obesity? By measuring the body mass index. So you check the weight, you check the height. These are things we are going to be doing today. Apart from checking the blood pressure, we are still going to check other factors to be sure that they are aware. Also, we are also going to check the sugar level, because there is a close relationship between diabetes and hypertension. So if you don't control one, the other one is she. So we are doing that today. We are also checking the blood sugar level of our patients and those that are willing to come. It's a routine screening for everybody. So I encourage those who are within the vicinity to come around and get their blood pressure.
Okay. Now, Dr. Isusa, you are the woman here. Somebody is trying to know, you know, we may not mention names now, but we have liquid seasoning. You know, on our tables, we have liquid seasoning that you sit on the table, you just add it to your food and all that. Is it advised for BP patients? Okay,
liquid seasoning. Once you taste it, all right, even those seasoning cubes, you say, no, I'm not adding extra salt, I'm adding seasoning cube. Once you taste it and it's salty, salt is salt. You understand it? So we don't want excess of those things in our meals.
Okay. All right. So let's quickly talk about some other things that we may not have mentioned now. We have talked about diabetes as a kind of one of the attendant, you know, ailments of blood pressure and all that, high blood pressure. We've also talked about cardiovascular problems, heart attack and all that. So are there things that somehow they are related? When you trace their root now, it is because of high blood pressure that we've not talked about here. Dr. Akinkumi. Now.
Okay.
Yeah.
High blood pressure, as we said earlier, is a risk factor for many disease conditions. We have mentioned from the heart attack, what we call myocardial infarction. You don't just wake up and say, oh, chest pain. And before you know it, the person is breathing fast, the person is collapsing, heart attack. And that's a very serious one because managing such cases is actually very expensive, and things like that. That's why we are emphasizing on early detection and prevention of those kind of things, because managing it's actually a huge cost to the economy, and we know the kind of economy that we have in the country. So prevention is key in that regard. Also, heart failure is also very common, in which we know that hypertension makes the heart get bigger, and to some extent get to a particular level that the heart function will now gradually reduce. The heart is not able to perform the function that used to do, and that's why it's people, someone breathing fast, the leg are swollen. They cannot walk from here to that gate without stopping on the road and catching some breath. And that those things are setting in their complications of hypertension. And those are the things that I want to avoid by this kind of enlightenment. Other things include things like blood vision, called blindness, and we can cause sudden blindness, because they're what we call hypertensive retinopathy. Someone can just wake up and they cannot see, blood pressure is too high, because there's leakage in the pipes, blood vessel that supplies the eyes. So that can also happen. Also stroke. Now it's very dramatic. You somebody in the meeting today, even the maybe the bottom of that meeting, and before you know, they say later in the day, but it's no more. Maybe it's so high, ruptured the vessel in the brain, develop stroke, and those kind of strokes are very catastrophic. And those are the kind of things I want to avoid by saying that people check their blood pressure. 2, people that are aware that they are hypertensive should come to the hospital and get medications for their blood pressure. 3, they should take those medications, because drugs that they don't take will not work. You know, some people swallow, flush their medications, some people just throw it somewhere. Some people will say, hey, it's something that will kill someone. They have the medication, they are aware they are hypertensive, they're not taking the medication. So we are emphasizing people should take their medication according to prescription. And also people come back for checkup, so the doctor will check you up and see if your blood pressure is controlled. So controlled blood pressure is another type of teaching entirely, because it's not everybody that is hypertensive and is taking drugs that are actually controlled. And if blood pressure is not controlled, the same problem that happens in someone that is not aware as hypertensive also happens in someone that is taking drug and the drug is BP is not adequately controlled. So control is also very important.
Dr. Osage, some persons, they have high blood pressure in their eyes. That leads to glaucoma eventually. But the blood pressure in their body is not necessarily low. So what should we do?
All right, like we said before, hypertension is a silent killer. And the problem with hypertension is that it affects virtually all the organs of the body, from the brain to the toe. So you could imagine every system being affected by blood pressure, high blood pressure, if not well controlled. The eyes are not spared. The eyes are one of the organs that are usually affected when the blood pressure is high. Usually what happens is that there's occlusion of the vessels, the retinal vessels, because of blood pressure. And that's what we call hypertensive retinopathy. So hypertensive retinopathy is a complication of hypertension.
A special
Not
hypertension,
yes,
you want to say.
exactly, not glaucoma. Glaucoma is as a result of pressure difference in the eyeball.
In the eyes, yeah.
Retinopathy is usually what occurs when hypertension is when the blood pressure is very high. That's when the patient has hypertension. That's usually where what occurs. And prevention is, like we said, is key. Like we said, another thing I also need to say for prevention is issue of use of illicit drugs. Yes, because among our youth, because one thing we've noticed of recent, youths, young men and women are not covered with hypertension. And one of the causes is illicit drugs.
Drugs, yeah.
There are lots. There are lots. When you come to hospital, you see them taking different forms of and these are things that affect the blood vessels and hypertension. Another thing again is the use of herbal medication. I know it's common in Africa. People feel that you take herbal medication, your blood pressure will disappear. There is nothing like that because this herbal medication contains a lot of toxins that can affect the blood vessels.
Okay. All right. So, Dr. Isosa, it won't be natural for us not to talk about the pregnant woman, at least. From experience, I'm not a woman, I've not been pregnant, but from experience, I know that a pregnant woman may be hypertensive. Is it natural?
Yes, there's what we call generally hypertensive disease in pregnancy. It can occur in two ways. It may be that the woman had an hypertensive ab initio before she ever got pregnant. That's one group of people. But there are some people in which the pregnancy itself causes what we call pregnancy-induced hypertension. And when this happens, we manage them as much as possible together with the obstetrician. And most times after delivery, the blood pressure usually will go back to normal. But in a few number of percentage of them, they may now need to be on antihypertensives for some time. So there's what we call pregnancy-induced hypertension, and that can also be managed. Okay.
All right. So you see that all that we have done here today is to further stretch the awareness that hypertension is real, and of course, high blood pressure is real. Hypertension and hypotension, low blood pressure is also real. So you must ensure that you know the side of the divide that you belong to, so that you begin to apply early medication so that you don't become a victim, of the situation. I want to say a very big thank you to Dr. Isosa Ogbomo, a consultant cardiologist with University of Benin Teaching Hospital, and also Dr. Akinwumi Ojo, who is also a senior registrar at the cardiology department, UBTH. Dr. Osaigi Egbodion is also a senior registrar with the cardiology department, University of Benin. Thank you so much.
Thank you very much. Thank you
for finding time to come on the show today. Yeah.